Most misdiagnoses don't come from not knowing enough. They come from deciding too early. You're in P-Pal here. Welcome to another conversation from the track. All right, so today's segment is Stop Anchoring. How providers miss diagnosis in urgent care. All right, so a very common thing, a patient will come in with a complaint. And not just a complaint, they already have the diagnosis, right? Oh, I have this, oh, I have that. And so I've seen it over the years, how a provider will just lock on to that conclusion before even collecting the story. So a few months ago, I had a patient, she was in her 80s, and she came in and she was having this right-sided chest pain. And she was in a car accident like 2 weeks prior. And the pain had only started 3 days ago. So, of course, they come in, they tell the front, and so that'll be on the tracker. And then the tech or whoever goes in there and they get the story or whatever, and then they'll come and tell you. And as we all know, it's going to be 2 or 3 different stories that you actually get, right? And sometimes by the time you get in there and then you ask them again what happened, they're already frustrated. But that's fine. You can be upset or well, I told the story 3 times. That's fine. I need you to tell me one more time because I'm the person that can actually do something about it. So this lady, she was like, oh, well, I'm having this right-sided chest pain. I called my doctor and he told me to come in here and get a chest x-ray. I was like, okay. So then she started telling me the story from the car accident. She ended up like hitting her head and went to the hospital, CTs, everything was negative. She got out and had been fine. And then 3 days prior, the chest pain started. And so part of our job is to, as we're listening to their story, we also are filtering out what's important and what's not. Kind of like a test question in nursing school, right? When they'll give you this long paragraph and you have to cross out all the stuff that's not important. That's what we have to do just about every patient encounter. So after she finished, I basically determined that car wreck had nothing to do with this because she didn't hit her chest. She wasn't having any chest pain. Nobody even said anything about it. She didn't have any problems, but in her mind, it was related. And so I just started to tell her, I was like, well, I definitely want to get an EKG. Oh my gosh, this like set her off. She got so upset. Well, my doctor told me this and that. I just came in here for an x-ray. And so our job is to evaluate the patient, right? I get they come in with instructions from their doctor all the time. That's fine, but I'm still going to do my part. I'm still going to evaluate you. I still need to get the story and tell me what happened and let me figure out. Don't you come in here with the answer that you think is what it is. You know what I mean? And so that's a very important point. They come in there with a diagnosis, but what they're actually there for is to give us their story, right? I don't need the answer from a patient. I don't need them to tell me what they think it is. Tell me what happened. Let me determine that, okay? Because I've seen providers lock onto something and then they go down this path and you miss a bunch of stuff or things that are not even important, things you didn't even consider because this idea was just planted in you. And it's happened all the time. And of course, we've all done it. I've done it sometimes, especially if it's like they say one thing and then the tech, oh yeah, they just said this. And so you're just getting this information. And so you're already locking in like, oh yeah, I already know what this is. And you haven't even seen the patient yet. So that's something that it can be problematic because you can miss something serious if you just lock in on that one thing. So back to that patient. So I told her, I was like, well, I'm not saying that I'm not going to do the chest x-ray, which I will, but I'm still going to do an EKG because it's still chest pain regardless. And then she got snappy. Oh, well, I just had a full checkup 3 weeks ago and my heart was fine and blah, blah, blah. And I'm like, okay, like, for one, I'm not gonna argue. I don't argue with patients. That's fine. You can be upset, but there is a process. And one thing that you have to do as a provider, stay in control. Don't let them take over control. You should be in control the entire time. Even if they're kind of aggressive and they're kind of moving how things go, no. So let them talk, and then okay, so here's what we're going to do. And that's fine. So I wasn't dismissive. I told her, I was like, we're going to do the x-ray, but it's still chest pain. So we're still going to do this EKG. And so not only did I tell her, I told her why. And that is another point, that when you're trying to convince somebody of something, if you tell them why, they usually receive it a little bit better. Okay, they're less defensive usually, and there's some understanding. And so I was like, well, ma'am, I just need to make sure. I'm not saying this is something cardiac, but I want to do my due diligence and just make sure that we're checking all the boxes, that we do not miss something. Okay? And so she still had a little attitude, but that's fine. Because I'm going to be safe regardless. Not only that, she's in her 80s. That's an 80-year-old heart. Who knows what this is? Even though it's on the right side, don't just downplay, oh, there's no way that could be cardiac. Don't lock onto something, okay? Because there's actually a process that I use. It's a clear framework that I'm talking about. And I mentioned this in other videos, that you have to collect the story first. Collect the story. So that's why I talk about the interview being a very important part. One of the most important, because that's where you get all the data. So as you're doing that, you look for red flags. That's the L. Look for red flags, right? Is there anything that's concerning right now? So you're going through like this filtering process. And then E, what environment are you in? Are you in primary care? Are you urgent care? Are you in the ER? Because that determines what you can actually do. And then the A is you act based on that information that you just collected. Make the best decision. Is this something where you can write a prescription for? Is it something where you need to escalate? Send them out. Or is this like a referral type situation? And then the R is routing the patient appropriately. Is this something that they can be discharged? Do they need to go to the hospital? Do they need to go see a cardiologist? And so using that framework, it just makes your life easier. But don't just lock on to a diagnosis. And it's tough, because especially when you have those aggressive patients, when they already have the answer in their mind and they're already convinced that that's what it is. And that's one of the most difficult parts of our job, because we have to fight against people's convictions, right? Either they've already decided themselves, some non-medical family member has already told them, Google, and now we have AI, and so they can really have a lot of information before they even get there. And so it can be very challenging, but stay in control, okay? And go through the process, go through the motion before just locking onto it, because you could miss something a lot of times, something that's important, if you just lock onto that. And it's, patients, they're not as simple as they present. Or like, because a lot of times the front, oh, this gonna be easy one. Oh yeah, all this. Oh yeah, they just need the blood pressure refill. And then they get in the room and it's like, 234 over 120. Of course, the story is always more complex than what it is. So don't take shortcuts. Slow down, get the story, get the information, determine the situation where you are, and then make the best decision possible, okay? All right, so if y'all have been following along with my channel, I put out content weekly. I'm here to uplift the nurse practitioner role, because there are a lot of times we're just kind of thrown out here and we have to just figure it out for ourselves. So if you found this video helpful, hit the like button and subscribe. And as always, you're in Peep Out here, practice boldly, and I will see you on the next one.